Hi, my name is Tiffany, and I will be presenting the paper Making Community Beliefs and Capacities Visible Through Care-mongering During COVID-19. The context of this work is the COVID-19 pandemic, which began in March 2020. Since then, in January 2023, at the time of this recording, there have been over 100 million cases and at least 101,000 deaths in the United States. It took the US by surprise, and the lack of national response that was coordinated left it to cities and to citizens to decide how to best respond. Resources were stretched thin as needs surged, such as financial, housing, childcare, and healthcare. The motivation for this work is to bring visibility to the importance of caremongering on community beliefs and capacities, and by showing how socio-technical systems such as social media can facilitate caremongering during crises. So, the study objective here is to understand the different types of caremongering that happened in caremongering groups during the early stages of COVID-19 pandemic. Try to answer three different research questions. The first one, in what ways do local communities use social media caremongering groups to practice caremongering during COVID-19? The second, how can this practice relate to community collective efficacy, which are beliefs, and community resilience, which is the actualized efforts that are produced by people in local communities? And thirdly, what are the implications to further support locally based caremongering that we observed? So we need to look really quick at the model of community proposed by Carroll in 2014. There are three facets: collective identity or community attachment, local participation or community engagement, and dense and diverse support networks. Going into community beliefs, this pairs with collective identity, the facet in Carroll's model. And basically, what this is feeling positive about one's community can lead to the belief that the community can develop to address challenging social conditions. Community collective efficacy, this term means a set of pooled beliefs that citizens hold about their community's capacity to successfully traverse challenging situations. Going into community capacities, this falls into the dense and diverse support networks facet of Carroll's model. That was the third one. And so basically, what this means is like strengthening the community collective efficacy that pooled beliefs can augment community resilience. And community capacities are a product of such actualized efforts. There's a nice definition over here on the right. Community resilience is a community's capacity to recover from collective adversity. Now let's look at the caremongering movement. So, in the early stages of the pandemic, many people had negative perceptions about their ability to do anything to help out during the COVID-19 disaster. This is because there was a lot of uncertainty in the air. People didn't know how to respond. This was new for them. And we define caremongering as acts of kindness that promote community camaraderie in geographic communities. So that's kind of where this came from. Caremongering on social media. So this is what we're studying in this paper. These groups first appeared in the early pandemic as a sort of paradigm shift away from what you typically see in social media as like fear mongering, spreading fear. And they were created by concerned citizens with the goal of facilitating direct disaster relief in local communities. And this goes back again to the kind of uncoordinated national response. Some of these disaster relief activities include aid requests, informational requests, and various forms of emotional support. Let's look at the methods for this study. So our data source was a public Facebook caremongering group. It had to meet a strict criteria to be considered a caremongering group. One of the main things was it had to consider itself as one. And we wanted to find a group that was in a place with a lot of cases during the early stages of the pandemic so we could really understand how people were helping each other. So we ended up choosing a group called COVID-19 Community Relief for Texas. It's a pseudonym. What we did was we collected the posts from the beginning of the pandemic in mid-March 2020 for about a year to the end of January, and we only looked at posts that met our criteria for caremongering posts. After that, we did a thematic analysis, iterative coding, and came up with our themes. You can read more about that in the paper. So let's move into the findings. What did we discover? The main finding here, the key takeaway is that social media plays a key role in facilitating three facets of caremongering. The first one is appreciation for helpers, the second one, supporting one another's needs, and finally, safe ways to socially interact. Due to time, we will only cover the first two, but you can read about the third one in the paper. Appreciation for helpers. So basically, the caremongering group facilitated acts of appreciation. A couple of examples are listed on this slide. Firstly, it raised visibility of helpers through threads. You can see that on the first quote over here. There were also like collective appreciation posts, which, people would, say, hey, we want to appreciate our healthcare workers, and people would, respond to that in threads. Interestingly, there were offline thank you event posts. So moving things off of social media into the real world, such as what you see in the second quote here. And then finally, people were sharing outcomes of the initiatives that they organized through the group, whether that was, how many people were fed, during a soup drive, or, how many masks were delivered, those types of things. Next, supporting one another's needs. These were direct actions to benefit local people or to support the well being of the community. This fell into a couple of different buckets. An interesting one being birthday celebrations. People during the stage of the pandemic were not going out of their houses, so celebrating birthdays was a little bit difficult. Communities came together to do that, providing food for people experiencing houselessness, and then finally reducing spread of virus in very creative ways, such as the second quote here, where someone offered to Zoom with, people in the local community during Thanksgiving, when people had a hard time visiting family. So what does all this mean? The first implication that comes out of this is these visibility of acts of gratitude. So this collective gratitude, such as the mask makers, shed visibility on a previously unrecognized community asset, which can build community collective efficacy, those beliefs that the community can overcome adversity. Next, appreciated people can feel that their effort is valued. They'll get a sense of worth, which may lead to additional participation, contributing to those actualized efforts such as community resilience. An implication for this might be a thank you board on social media where people can just post, hey, thank you, thank you, thank you, thank you, without those posts getting lost in, the timeline of social media. The next one, fostering participation in pro-social activities. So a post about these successful outcomes that we saw in the group can nudge others towards participation because it can remind people of achievements born of their collective efforts, going back again to community collective efficacy. People want to participate in groups that are successful, and that could lead to additional community resilience. And so one suggestion for this might be a picture book, which would be a central repository for collective outcomes that can suggest progress is being made in areas and also house all of the outcomes in one area for people to look through easily. One last thing before I wrap up that I really think is important out of this work is that caremongering empowers citizens through autonomous care. These groups develop capacities in the community, which are critical for long haul disasters. This type of long term support can lead to people becoming more self sufficient, can lead to, better things happening in the community. And these groups, because they're very local, they're hyper local, they tackle issues of local importance. And most importantly, this makes people into active contributors rather than passive consumers of care. Thank you very much. If any of this is interest to you, let's keep the conversation going. You can contact me at the email listed below. Thank you.